started.
Okay, everybody, we're going to go ahead and get started with Chapter 39, starting with the female reproductive system. I know y'all are so excited that this is the last lecture to listen to, and I am so excited that we're almost done with this too. So remember, if you have any questions about anything, just feel free to email me over the next couple weeks, and I'll be glad to answer any questions that you might have. Okay, so let's go ahead and get started with the female reproductive system. Sorry, guys. I know a lot of this for you is just boring. For the girls, this will come pretty easy. But anyway, it's something you got to learn regardless. Um, you know that the primary function of the female reproductive system is the preparation of the body for conception of a baby and gestation. All right, primary function. This next slide here is just um, refresher here of the female anatomy in case you need um, a reminder of that. And I know you all have your A&P books if you need to go back and remember where um, everything is anatomically located. This next slide here basically is really like three different slides if you look at it, because this shows you um, the relationship between the pituitary hormone release of, remember back to the endocrine system when we talked about how the pituitary gland released the luteinizing hormone and the follicle stimulating hormone in order to stimulate the ovaries to secrete estrogen and progesterone. And this shows you the relationship between the pituitary hormone release, how that relates to the ovarian cycle, and how those two things relate to the uterine cycle or the menstrual cycle. Okay? Um, Back to the estrogen. Remember, the estrogen is one of the female hormones that's responsible for the development of female sex characteristics. It helps with bone maturity in the female, muscle development, helps to maintain skin and blood vessels, and provides, obviously, for the reproductive processes, which include ovulation, conception, pregnancy, delivery, and then even on into lactation. Now, the progesterone is mainly for maintaining pregnancy. And actually, over the last several years, they have realized what an important part that progesterone plays. A lot of women don't have trouble getting pregnant. They have trouble maintaining their pregnancy. And they can actually give them progesterone shots now and help them maintain their pregnancy, and have actually saved a lot of miscarriages over the last several years. Remember that the woman's endometrial cycle is 28 days, give or take. The ovarian cycle is made up of the follicular phase, teal phase, that you see up there in the middle section of that picture there. And then you have the premenstrual phase that happens just before menses, or the woman's period, and then ovulation happening about halfway through the 28-day cycle. So let's go ahead and start talking about some disorders. And when we talk about these disorders, really what you need to do is just know the symptoms. I won't go into a lot of detail on the test. I'll probably be pretty much cut and dry. And the best way, and really I'll just tell you up front on the test, I'll just describe symptoms, and you can just pick out the disorder is usually the way it goes. So let's start with dysmenorrhea, which is painful menstruation or painful periods, basically cramps. I know all you females have probably had cramps. They can be primary or secondary. Primary dysmenorrhea is related to abnormal prostaglandin release. Secondary is when you have cramps related to some other cause, endometriosis, maybe you have pelvic inflammatory disease, or maybe even some fibroids or some little tumors there on the uterus. A lot of women have really bad cramps that radiate to the back. Sometimes They have nausea and vomiting, excessive fatigue, headaches, dizziness, diarrhea. Usually the symptoms are worse the first day of their period and usually resolve after a couple of days. Just a little key here, or FYI, on the primary dysmenorrhea that's related to abnormal prostaglandin release. A lot of times that's why women will have better success when they take like regular aspirin, because remember the aspirin inhibits prostaglandin, and if they have primary dysmenorrhea, a lot of times just regular old aspirin will help better just because of the prostaglandins. Abnormal uterine bleeding most often affects women between the ages of 40 and 50, usually because there is a disturbance of the menstrual cycle. Usually they have no ovulation. Okay, anovulation means no ovulation. And a lot of times it's because of a lack of progesterone, and maybe even because they have different levels or different amounts of estrogen that lead them to have endometrial tissue that sloughs off during abnormal periods of time. Some types of abnormal uterine bleeding, and again, this is just memorization, okay? Polymenorrhea. Poly, remember, means more. So remember, a normal menstrual cycle is 4 weeks, 28 days or 4 weeks. So polymenorrhea would mean they have menstrual cycles that are shorter than 3 weeks, meaning that they're having periods every 2.5 to 3 weeks, which is a lot more often than I would want to have one. Oligomenorrhea, the cycles are longer than usually, definitely longer than 4 weeks, but anywhere from 6 to 7 weeks. So these women are going a longer bit of time between their periods. And then metrorrhagia is when you have bleeding between cycles. Menorrhagia is when you have an increased amount of bleeding during the period. And then amenorrhea, A, remember, is without, so there is no menstruation. And it's very common for athletes, athletic women, to have amenorrhea. Girls who are anorexics a lot of times will not have a period as well. So just a couple of examples there. This is one that everybody can relate to, even the guys, if you have a girlfriend or if you're married or whatever. PMS, premenstrual syndrome. Now, your book says that it can occur anywhere from 3 to 14 days prior to the beginning of the period. Somebody would probably kill me if you had PMS anywhere from 14 days prior to your period. Anywhere from 3 to 5 days before you start is pretty common. Signs and symptoms may or may not be relieved when the period starts. Some people would probably say that they even get worse. More common between the ages of 25 and 35. The symptoms here. Irritability, I'm going to say first because that's usually a big thing. Breast tenderness, bloating, you feel swollen, backache, headache, fatigue, maybe some abdominal cramping ahead of time. And did I say irritability? Yeah, that would be like the big thing there. They say treat with regular exercise. Don't drink caffeine because that supposedly makes it worse. And then alcohol tends to make it worse too. So, all right. Uterine prolapse is just when the uterus descends from its normal position. Okay, it prolapses, just like the name says. Usually because of muscle weakness there in the pelvis. The symptoms depend on how severely prolapsed the uterus is. Some people have pain, discomfort. There may even be some bleeding. Again, it depends on how far out of normal position the uterus actually is. A lot of times people will actually have to have surgery to replace the uterus back into its normal position. Another problem that is along with this is when you have a cystocele. This is protrusion of portion of the bladder into the vagina. You see this very commonly in your older women who have had multiple pregnancies and vaginal deliveries, obese, people who lift heavy objects, pretty common. And usually the uterine prolapse and the cystoceles will go together. Um, there's a neat little procedure there where they can actually go in and uh, I don't know the word really I'm trying to say, but actually just bring the bladder back up, and they suspend it basically with um, a mesh lining kind of to hold the bladder, and they can do that with the uterus too to put it back into its normal position. A rectocele is when you actually have a protrusion of the rectal wall into the vagina. Yes, I did say that, protrusion of the rectal wall into the vagina. That's always fun, too. Again, goes along with having those little children that are just beautiful and wonderful, but do they cause some problems to the woman's anatomy? Anyway, there you go. Okay, pelvic inflammatory disease is when you have inflammation of the upper reproductive tract that can involve the uterus, the fallopian tubes, and or the ovaries. You see this more often in females, your younger females, aged 16 to 24. Usually they have multiple sex partners. Most of the time they've never had a baby. Signs and symptoms would be lower pelvic pain. They usually have a fever and high white count. May actually have purulent vaginal discharge, and they have a painful exam. Some of the causes down there I listed for you, basically bugs that can cause pelvic inflammatory disease, gonococcus, chlamydia, um, some of those favorites that you hear about. Some complications that can result from pelvic inflammatory disease, you can have peritonitis, which would be an inflammation of the entire peritoneal cavity, there where all of your internal organs sit there in the abdomen. Adhesions, which is like scar tissue basically from the severe inflammation. Bacteremia, those same bugs that are there causing inflammation in the pelvis can actually get into your bloodstream and can lead to infertility if it's not treated appropriately. Uterine leiomyomas are fibroids. Okay, that's leiomyoma is the long, nice medical term for a fibroid. The growth of uterine fibroids are influenced by estrogen and growth hormone. Most of the time, signs and symptoms would be abdominal pain, pressure, and it says bleeding. I would add heavy to that. Heavy bleeding a lot of times. Women will have heavy bleeding with their fibroids, backache, maybe even constipation, depending on how large the fibroid is and how much it is pressing against the colon. That's actually one of the big reasons that women will actually have hysterectomies, because they have fibroids and they bleed so bad, and it's so aggravating at that point. They'll actually go ahead and opt to have a hysterectomy if they're not planning to have any more children. Ovarian cysts are little sacs on the ovary that have fluid or semi-solid material. These are very common, usually caused by the failure of an ova to rupture or degenerate the way it's supposed to. Most of the time, these don't cause any problem, no real symptoms unless they rupture. And then the woman will usually have really bad pain, and they might actually even hemorrhage if it's large enough. But a lot of times, women who have ovarian cysts, if it's small, the doctor will just keep a watch on that, and it usually doesn't cause a whole lot of problem. Endometriosis is very common. This is when you actually have endometrial glands or cells or uterine glands or cells that are outside the uterus where they're not supposed to be. This, again, very common. Signs and symptoms: painful periods or dysmenorrhea, pelvic pain, dyspareunia, which is painful sexual intercourse, pain when having a bowel movement, pain or burning with urination, constipation, menstrual irregularities. Their periods won't be regular and then can lead to infertility if the tissue is large in size. A lot of times women, young girls even, will have to go in and have some surgeries where they'll actually scrape that tissue and clean that tissue off of the outer portion of the uterus where it's not supposed to be. Cervical cancer, we've heard a lot about cervical cancer over the last several years. This is what the doctors are looking for when they do a pap smear on a female. It's believed to be linked to the HPV virus, number 16. We all know, and you've all heard, there's been a recent vaccine developed against HPV. You see that on TV, let's be one less, you know. The medical associations also developed a grading system of abnormal cell types, which has helped a lot in grading possible cervical cancers. Some risk factors. Hey! Some risk factors there. Girls that have had intercourse at an early age, those that have had multiple partners, a male partner with multiple previous partners, women who take oral contraceptives, oral birth control pills, smoking, those who have had children. That's what parity is. Parity means that they've had children. Just having children or giving birth puts you at risk for cervical cancer. Having a family history of cervical cancer, certain infections, and then having intercourse with an uncircumcised partner, obviously, that doesn't have very good hygiene, is at risk. And if y'all are wondering, somebody else just came in and I had to speak to them because, you know, I have to everybody. Anyway, the clinical course of cervical cancer, usually the cell changes are pretty slow. Women will actually complain of some irregular vaginal bleeding, maybe some vaginal discharge, pain after sex, pain and burning with urination, and sometimes some pain that radiates to the back and down the legs has been a common complaint with women who are diagnosed with cervical cancer. But again, it's very, very important that women, girls and women, especially those that are sexually active, have their annual pap smear to try to detect cervical cancer early. Endometrial cancer, uterine cancer, some risk factors here: obesity, diabetes, hypertension, infertility. And if you look at this list, all of these above diagnoses here, with all of these, there's actually an alteration in estrogen. And their estrogen levels are actually higher in all four of these categories, which is why your risk for endometrial cancer goes up. With endometrial cancer, the main symptoms that women will report is abnormal vaginal bleeding, but no pain. They have abnormal painless vaginal bleeding, and they may actually have some vaginal discharge with leukocytes that are present. So if I were to ask you on the test, which of the following cancers do women complain of abnormal painless vaginal bleeding, you would obviously know that it was endometrial. Ovarian cancer is the leading cause of death from genital cancer. Some risk factors: not having any children, never giving birth to a child, having a family history of ovarian or breast cancer actually increases your chances of ovarian cancer. Um, Signs and symptoms: abdominal pain, bloating, constipation, which is usually caused by the ovarian tumor that presses on the organ. For some reason that they really don't know, the symptoms usually resemble your gastrointestinal symptoms like gas, abdominal bloating, especially after eating. So the problem with that is women don't go and seek treatment until the cancer is advanced, and a lot of times there's already some metastasis with that. Um, they will obviously do surgery, maybe chemo, maybe radiation. A lot of times the prognosis is not very good. We're getting toward the end here. Let's talk about some breast diseases, starting with fibrocystic disease, which is very common. Um, Usually seen in your younger aged girls when these are just palpable lumps. Um, See this anywhere in your 20 to 40-year-olds. The only problem with fibrocystic disease is that it increases your risk for breast cancer. Signs and symptoms: pain and tenderness. Obviously, you'll feel some lumps if you do your breast self-exams, and usually they're painful during your period more often. Caffeine actually increases your incidence of fibrocystic disease. There's some debate about that now. My OBGYN still seems to think that caffeine does make fibrocystic disease worse and actually encourages me not to drink a lot of caffeine. Um, I don't listen to that very often, but anyway, that's what he says. So, um, breast cancer is the most common cancer in American women. Um, your risk is increased if you have a family history of breast cancer, especially in your first degree relatives. Race plays a part. Black women have a higher risk factor up to the age of 40, and then white women after the age of 40. Parity or childbirth plays a part. If you've never had a baby, or you're nulliparous, or if you had your first baby after the age of 30, that increases your risk for breast cancer. And then obesity will play a part as well. Again, it has to do with that estrogen exposure. Um, if you started your period early, before the age of 12, if you had a late menopause, meaning that you continue to have a period until, say, after the age of 55, postmenopausal estrogen therapy has been a huge debate over the last 10 years. They came out within the last 10 years saying that women who were on estrogen therapy after menopause were at greater risk for breast cancer. Now they're kind of taking that back a little bit. A big debate. And then women who have been on birth control pills. Again, it all has to do with the amount of time you are exposed to estrogen is what the deal is. And we're so lucky now because we know that there is actually a genetic link to breast cancer, and we can actually test women for that gene. So if breast cancer tends to run in your family, you can actually be tested gene to see if you know where you stand, and if your risks are even greater at that point. The problem here with breast cancer is that most women with breast cancer have no risk factors at all. So that's why it's so important to do your monthly self-breast exams and then have that yearly GYN follow-up. Prognosis depends on the size of the tumor, if there are any lymph nodes involved, the type, and then how fast it is regenerating. Breast cancer treatment, again, they can do different types of mastectomies. It may just be that you have a small lump where they can actually remove the lump or do a lumpectomy. They may do a simple mastectomy where they remove the breast tissue, or they may do a radical mastectomy where they remove the breast tissue and lymph nodes. Again, it depends on the tumor type, how large it is, and then if there are any lymph nodes involved. Radiation and chemo usually go along with that treatment. And that is it on the female reproductive system. Again, if you have any questions on that, you can email me at any time. I know, guys, you may have a harder time with this, obviously, than the girls will. But we'll be moving on back to Chapter 38 next. Archive recording.